Namaste. Thank you, Dr. Shekhar, for inviting me for this Global Ayurveda conferences. My name is Jaya Dabtardar. I'm Ayurvedic doctor, healthcare executive, licensed aesthetician in state of Connecticut, a writer of 3 books, and a speaker for the conferences. So my today's topic for this conference is Ayurveda's aromatherapy for insomnia. So let me share my presentation here. Bear with me for a moment. Okay, so hope you can see it now. And let me put it in a slideshow mode. Okay. So, Ayurveda and aromatherapy for insomnia. I have my website here for the reference, www.ayurbeautyandlifestyle.com. So, Ayurveda is 5,000 years old science of life. Ayurveda has 3 pillars of health in Ayurveda. Ahar, Vihar, and Nidra are those 3 pillars. Ahar is the balanced diet. Vihar, that means the regular exercise, yoga, and the activities. And the third one is sufficient deep sleep. That's Nidra. It is very important. It's reported by WHO that 25% of the world's adult population between ages 21 and 60 suffer from insomnia. That's a big one. But what is this insomnia, right? Insomnia refers to a sleep disorder where an individual faces problems with falling asleep and remaining in a rested phase through the whole night. It can present itself either as a short-term imbalance, that is acute, or long-term, that is chronic condition. When the condition like insomnia is not treated for a long time, then it becomes chronic, and then it takes a while to treat. So, types of insomnia. One is primary insomnia, and other one is secondary insomnia. So, primary insomnia is the form of lack of sleep arises due to physical or emotional stress, excessive traveling, or demanding work schedules, and it is a distinct illness of its own. So, secondary insomnia is it is due to the underlying medical conditions. So the main factors triggering this variant of insomnia include side effects stemming from other underlying neurological conditions or mental illness, as well as from long-term medications too. Okay. So signs of insomnia. Insomnia prompts signs of lethargy, persistent yawning, irritability, weakness, and lack of concentration. It negatively influences professional commitments, personal relationships, and hampers a person's productivity. So this is a big one. If insomnia is not treated, or it is intermittently happening, it affects the personal life, social life, and the physical life. However, it is not a life-threatening disease, and it can be effectively managed by Ayurvedic remedies. Aromatherapy is one of them, and numerous solutions are mentioned in the ancient Ayurvedic practice. So reasons according to Ayurveda, what could be the reason, right? In Ayurveda, insomnia is termed as anidra or nidranasha. And it is caused by a specific imbalance of these three doshas. Let's find out in the next slide. Doshas involved in the imbalances are Tarpaka kapha, it's one of them. It is an auxiliary dosha of kapha, and its job is to nourish the cells of the brain, resulting in the restful night sleep. When this dosha is not in balance, the brain cells go unnourished, causing insomnia. Then another one is pranavayu. This is a supplemental vata dosha. It creates a sensitive nervous system. And this together with aggravated pranavayu causes insomnia. It is also linked to depression, specifically anxiety and worrying. Sadhaka pitta. It refers to a crucial pitta dosha found in heart. It controls all of our emotions, spirituality, decisiveness, and desires. Any imbalance creates problems with resting functions in the body, leading to insomnia. A good night's sleep confers immense merits for well-being, such as sukha, happiness, pushti, nourishment, bala, strength, jnana, knowledge, and jivita, life. Whereas very less sleep induces dukkha, unhappiness, karshata, emaciation, abala, weakness, ajnana, impaired wisdom. So, good night sleep is happiness and strength, right? Happiness, strength, knowledge. What are the remedies? In Ayurveda, Abhyanga, oil massage. Abhyanga is a different type of massage in Ayurveda. It's applying the stimulating oils like Bhringaraj, Tila, which is sesame oil, on the head and pressing down on the scalp in a gentle circular motions remarkably soothes the mind. This in turn boosts the blood circulation to the central nervous system and helps overcome insomnia. Samohana, body massage. This is the full body massage. This reviving procedure involves harmonizing full body massage using soft materials like silk, fluffy brushes, as well as aromatic essential oils such as almond oil, rose oil, jasmine, lavender, sandalwood oil, also comprising a pacifying steam bath after the massage. It offers noteworthy characteristics, vastly improving the quality of sleep. You will notice very fast. So today I'm going to present a research paper which was published in Wiley Online Research. This is the aromatherapy effects on sleep quality and anxiety of patients. So this was published by Ezgi Kardak, PhD, RN, Sevgin Semensioglu, PhD, RN, Dilek Ozden, PhD, RN, Arkan Bekir, MSc, RN. So most of these researchers, writers are PhD in nursing. So, what's the background of this research? In intensive care units, patients cannot sleep well. Aromatherapy is used for depression, anxiety, relaxation, and disorders related with sleep and stress. What was the aim? This study aimed to investigate the effect of lavender essential oil on the sleep quality and anxiety level of patients in coronary intensive care unit. Participants of this research, a total of 60 patients in coronary intensive care unit participated in this study. Design. A randomized control study was conducted with 60 patients in a province located in the southeast of Turkey. That was the location. What was the method? After informing the patients in both groups about the study, they were administered a questionnaire. Petersburg Sleep Quality Index, that was the questionnaire, and the Big Anxiety Inventory Scale, that was the scale. The patients in the intervention group were given 2% lavender essential oil via inhalation for 15 days, after which they were administered the same scales again to evaluate the sleep quality and anxiety. As for the control group, they were administered the same scales again after the 15 days without the inhalation of lavender essential oil, and it was compared. So the results, comparison results of the PSQI scale that I mentioned before and BAI score of the patients in the control and intervention groups before and after the intervention showed statistically significant differences in the change in favor of the intervention group. So, what was the conclusion? Lavender essential oil increased quality of sleep and reduced level of anxiety in patients with coronary artery disease. It's a big one. Thank you. Okay. Thank you so much for listening.